Second, on the progress that is made so far, productive and poignant. And services and quality services, whatever we commit can only be done when we have adequate amount danced. But we was the Ethiopian in the African way of, I hope you have enjoyed the state dinner, and now dance of organizing information, and will be conducted in another session. Even though we have acted on equity, quality, and improved finance of mothers and children from countries. And also Anthony Costello, for me stating their specific profiles.
And confident the SDG.
Transformational vision. Our future and our children's depend on.
Continued progress will require strong alliances and quality equity.
There is no keener revelation
to save women's lives in pregnancy and childbirth, care during labor and
to the 2016 study and returns about $44 in economic benefits, and you can't.
Discussions we had yesterday and how productive talks will be co-moderated by Robert Clay, Vice President for the Save the Children, which gives children around the world. Joining Save the Children, Robert was the Deputy Assistant and represented the US government on the Gavi Executive Board at the University College London. Dr. Costello holds the James Spence Medal of Royal College of Pediatrics.
Great to be here, and I want to first thank the 12. We were just trying to reach 2 areas of humanitarian assistance and development, and part of it so that we can move better through this. We have an excellent panel in Nepal, in Haiti, crisis in their year from our through dive, and he's currently working as the emergency health with the epicenter in April 2000 Nepal earthquake response program, instruments of vaccine preventable and management and leadership. Dr. Grandpierre currently directs the Family Health Unit at the Ministry of Health in Haiti, where he has served since 2012. Zola is the Deputy Minister for Planning in the Ministry of Health in Liberia. She holds degrees in zoology, research, policy, and strategy, led the team of for future crises there.
Ministries like preparation done on hospital building actually helped mitigate a lot of casualties, things, namely Red Cross. Red Cross had a lot of preparation. We could visit in the communities too. So in terms of preparedness, response activities into, we need to take the lesson learned from the earthquake that we had. I see that resilient infrastructures. Second thing, what you call in our programs, your DR, as we call it, as a humanitarian organization, I need to do the regular work. And third, you mean, like, if we do not have preparations enough, would we be resilient enough for that change? There are emerging diseases coming in. And we also need to think those lessons into your...
About the, who will be speaking in. So, Dr. Grandpierre.
All I watched this morning, I'm going to continue in French. Le tremblement de terre et les autres, puisque c'est le si nous a mis face à des défis d'organisation, car a été de pouvoir cette réponse pour qu'elle soit effective.
And to forget these service providers who are also often the victims. Finally, it's also important on acting on the determinants of health, because the impacts of on the health are very much huge. We are talking about earthquakes, but last year we were also exposed to the hurricane, which devastated the productive sector and costing around $320 million. And it costed also $28 million to the health sector. So it's very important to act trade level. 2010, because we were very much surprised happened where it has enabled us to these mobile services, allowed us to control in less than 24 hours any sign of cholera. The clinics, the population, and imagine that access roads are allowed them.
Thank you very much, Dr. Grun. here. Discussion in the question. And Ms. Zolia Break, what lessons have you learned to prevent, mitigate, and manage the possible impact? And then what was the role of the government in terms of aligning?
Thank you very much, and I would like to thank the organizers and sponsors of this meeting. This has afforded us an opportunity to share. In Liberia, exposed the weaknesses we had in the health system, but it also afforded us an opportunity to, in the current SDG, a few of them are ownership and uptake of health interventions. When Ebola hit initially, we also learned that the health workforce is our greatest asset, effective, and do the work they intend to do. We also learned that health facilities need to be functional and structurally suitable to manage highly suitably enough to be able to manage use to take care of the victim. 2015 to 2021, the plan focuses on 9 investment areas. So in addition to this, making some investments in the health training institutions or postgraduate medical training to increase access to remote areas. The public health and respond to public health field, county, district, and community events include maternal and neonatal deaths, international health regulations, core capacity, and the Internal Affairs Ministry. We have moved. We have responded to in a manner. And again, we did that without disrupting the head and answer the other one. Okay, in terms of coordination, initially, we had difficulty and to responding, to
sharing all.
I'm going to ask for your questions in just a moment. Start with a and obviously in Liberia, were brought home issues about in the richest community resilience. The major response was, and continue to do so by having an upward voice. And let's see if we can get some feedback to what was presented. Any questions? Yes, I see one at the back. And
to the presenters, I would like to come back to the issue raised by the minister in Liberia. And then when it comes to the actual implementation of the perspective, how you have done your IHR core capacity assessment.
The speaker from Liberia, element of that question, doctors particularly.
From Pakistan, planning and learning from the disasters they've had. I would like to know what was the role of civil society in coordinating with the government in Grown Philanthropy played.
Okay, let's take one from Senegal and then we've got,
Nous avons entendu aussi
the narrative, we platform while taking care of this.
And give incentives so that they work in remote areas. And how do you deal with the problem of moonlight? Civil society in Nepal to, half of amputated. And problem with SDGs. Let's go along the panel. You can
brief on the role of civil societies and philanthropies. For us, the non-government organizations taking lead in what are the things to be done, what are the priorities, and how those priorities can be used in the communities. So, and one of the weakest point in post-disaster was our mental health issues, and how do we mitigate that, and plan on that aspect. So, the private sectors, as private sectors, I said philanthropy organizations and non-government organizations supported the Ministry of Health, the communities. So based on prioritize. So I would say a lot of the leadership is commendable. I mean, the leadership from the government was.
But on the reconstruction front, when they
regulations, there has to be plans. And if you do not.
I mean, earthquake building. I had a research fellow in Nepal using packed earth building. The buildings collapsed in Kathmandu. Methods.
No. The new structures actually has regulation that it has, and I think we need to learn the lessons.
La question venait, that was a building process, parce que le gouvernement et donc le ministère de la Santé a le secteur philanthropique, la société civile, la fédération.
Say here that the experience we have is put in country from WTS team. We'll performance-based finance to
much. Well, we're at time.
So we'll to countries where they've been focusing on mitigating these disasters over time. So we'll have 3 speakers, and let me just introduce them. Served as in this capacity as the state minister, Dr. Kebeb in Red Cross and Child and Adolescent the International Development Medical University will be Dr. Christina Galavat at CARE and HIV/AIDS prevention. She holds a PhD in Ethiopia, and it's evolved over recent years.
Developed a multi-sectoral and a multi-stakeholder national nutrition strategy, and program is well integrated into the health system, and the most services are provided at community level by nutrition days. Nutrition services also as well. The government has also in national will be the future financing and the universal access to health protection. National flagship, health community are women, and leadership and commitment to the mothers, and ownership in the part we face crop displacement of pregnant and lactating mothers to in the sanitation where pivotal are playing pivotal role in moderate acute malnutrition to supplementary feeding program, and those with severe reduction of or the services are provided detached mother from the therapeutic feeding program. Recovery is around 70. The health system is in partnership with international use, food, UN country team, and other donors, including
that we've heard. What modalities do you have to reach the populations?
I would like to thank. Since the early 2000s, the Afghanistan Ministry of Public Health has been contracting out health service to NGOs. We implement essential and primary health care in 31 out of 34 provinces and country centers across the country. Given the increasingly challenging scenario with armed conflict in many places in the country of the health 30 minutes of walking distance center. This is a significant improvement compared to a decade ago, and despite ongoing insecurity in many parts of the country. The ministry also partners with technical agencies, UN agencies, to complement the access to NGOs run services by or refer community members to health facilities. The quality rate, Afghanistan, 2016, more than 1 million Afghan forcible. And the short term and the party and also
behavior is so critical in terms of many of these crimes.
A strong and resilient health. Health is really produced. Apply to it, apply to both humanitarian and community level. So here in Ethiopia, the purpose of it is to catalyze community discussion and dialogue and reflection about the kinds of social and gender norms that exist in the community and may in fact be reproductive and maternal health, and brought them a number of other issues, financial literacy, about the household or labor, led to some remarkable results. And even after just 1 year, we saw girls saying that they were much more confident in their ability to talk to their partner about family planning. We saw an increase of about 27% in use of modern contraception, and the health workers were helping these young women to receive the services. The community also got together in the villages we were working and prevented 180 child marriages that can be really effective in overcoming a range of barriers. And there's now, a lot of research and evidence that shows that these kinds of processes, and especially empowering women and girls, is community trust. And we know health providers are that's impossible to really provide the best quality services in a development setting. So there are also a number of approaches here for really putting in health system. It's not that enable that work we've done with something called the number, the frequency, and the quality of. So I think those are the kinds of things building a responsive and resilient health system.
Thank you very much.
Have come out. To me, development is fundamentally about building institutions and social trust. And all speakers have highlighted 1970 Cyclone Bola hit Bangladesh and killed 500,000 people. And 25 years later, 1997 actually, Cyclone 5,000 people. a hundredfold difference. Right, questions from Serbia. So we have three quick questions.
Du système de résilience. Qu'en est-il du système d'alerte précoce? Parce que c'est vrai que les épidémies, les catastrophes ne préviennent pas. Et quel que soit le plan d'action de riposte qu'on aurait pu mettre en place, s'il n'y a pas un système d'alerte précoce efficace pour minimiser les risques, il est difficile au pays de pouvoir faire face aux catastrophes. Donc je voudrais savoir, après toutes ces catastrophes qui sont intervenues dans ces...
Thank you very much. Excellent question.
Merci beaucoup.
Border movement, there can be infections that any cross-border infection, and especially Liberia, have not had much about the surveillance, the strong surveillance country, extensive community workers, that we are aware about the dynamic workforce. Every time we see continuous capacity time, they are either upgraded or capacity is being built in order to handle dynamics in medicine.
How Uganda has had 1 million. Yes, sir. Where are you from?
My question goes to Ethiopia. You made a presentation on your health extension workers, and you focus on their role in nutrition. I wonder whether they are solely focusing on the nutrition or whether they have any role to play on issues to do with maternal health, and if yes, what specifically do they do? The second question, I would really love to hear a little the maternal.
Shall I go ahead?
Yes, please go ahead.
Thank you, Shan. My question is, the cost question is, could you give us some details about families have accessibility to food, malnutrition will continue to exist?
What about early warning systems? I've always thought of technology being able to predict disasters. You get two questions about the dynamics of the health workforce, maternal health, and then question about therapeutic ready-to-use therapeutic foods actually have better impact than the commercial ones. Was it? Oh, it was from Afghanistan.
Thank you very much. And at times of droughts, we need for nutrition because most of the time the drought is related with food supply shortage, and this predisposes food. And for those who are affected with moderate malnutrition, they would get targeted supplementary feeding program services as well. Regarding the polio virus outbreak in the world, we are working on the capacity building from day one. We do have integrated refresher training for services that they are providing. Health extension workers are not providing around 16 plus packages. Maternal child health, this include immunization, vaccination program has been evolving in the last 12 years, and we are also already we will completely upgrade their 20 used for complementary feeding as well as management of moderate acute malnutrition. And once the child is discharged from the civil acute malnutrition management center, he will be put on supplementary feeding services. And we don't call the health extension program as task shifting. They are given their tasks.
Dr. Amwari from Afghanistan, any comment?
Is the distribution points of the refugees that we have by this mobile team. We are providing immunizations.
There are a lot of, been adapted by a number of organizations as well, is really those issues, and then they come up with action plans, which they then implement and also monitor jointly. Consensus building on it's systematized, so it's something that can be
the health into the national climate focused as an environmental issue rather than as that from any of from Ethiopia.
Thank you very much. I forgot to address the climate change. Rest of the African countries, health is affected, and we have developed
this climate change before. But as you go, climate change has to be. There has to be evidence, and there has to be evidence dissemination to a lot of people.
Almost everything that you need to do, folks, heart attacks. So we've got to turn it, and I take away an awful lot of messages that are clearly preparation is everything. Lots of on mobile teams, and that's really encouraging. That Dr. Tedros is emphasizing emergencies team. I understand that CD financing, and we talked about climate resilience. And if you want to read more about that, there's a new WHO report on our website, generally, but also to shocks. We've heard about now strong primary health care and increased access, and all the countries are making good progress on that. Support to remote area of the burden of refugees, and Robert Clay for fantastic presentations, and I'm sure you...
Thank you very much, Dr. and heads of delegations. I thank you so much. Please a round of applause for the entire panel. I will take this opportunity at the next session, which is the Ministerial Conclave. Room number 3 outside this venue, holding room, so that it will make our life much easier when you are joining the Ministerial Conclave. In each of your desks, we have placed the proposed declaration, which is already being done now. Please keep in mind, we have maximum 3 minutes to address the critical Ministerial Conclave. Much of the time will be taken, will allow. We, as a head of the called Data Revolution or Revolutionizing Information, the Chief Executive Officer of Rollback Malaria and the previous Minister of Health of Ethiopia, who will also continue right after the end of the ministry for the sake of making sure all heads of delegations and we can start on time.